Welcome. We're starting on time this afternoon. We're glad you're all here with us. Thank you. I am Naomi Smook. I'm the Director of Estate and Plan Giving at American Friends of Magen David Adom. It's wonderful to have so many people here with us today from across the country. I especially want to recognize our Legacy Circle members whose commitment helps to ensure that Magen David Adom's life-saving work continues into the future. If you are not yet a part of the Legacy Circle, I hope that the next hour will give you a much clearer sense of why Magen David Adom's work must be sustained. Catherine Reed, our CEO, will be leading today's discussion. She's joined by Yoni Yagadovsky, Director of International Relations for Magen David Adom in Israel. Yoni's decades of emergency response experience has spanned both everyday emergencies and far too many mass casualty incidents. We are also incredibly honored to welcome Saskia Siderow, a healthcare analyst and respected journalist whose work focuses on the realities of aging in America. She's the founder and editor of the Aging Almanac, a Substack publication about navigating work, health, money, housing, and caregiving as we age. I've recently started reading the Aging Almanac and have been struck by its intelligent and practical approach to the challenges of aging. Together, our panel will explore what it means to face an emergency alone, both in Israel and here in the United States. It is a reality that touches so many families as we grow older, and the panel will discuss how we can better prepare for this. We will not be taking questions today so that we can really focus fully on the conversation. So, Kathy, Saskia, and Yoni, I thank you so much for being here. Kathy, I will turn it over to you. Welcome.
Thank you, Naomi. For those of you joining us for the first time, a few words about Magen David Adom, Israel's national emergency medical system. Founded in 1930, a full 18 years before the State of Israel, Magen David Adom is tasked by law with operating the country's national emergency medical services and at the same time is an independent, nonprofit organization. To give you a sense of the breadth and depth of MDA, it has over 3,000 ambulances and emergency vehicles, answered over 4.2 million calls into the National Emergency Call Center 101 in 2025, and calls answered on average within 2 seconds. In addition, MDA is responsible for the entire blood supply for the State of Israel, including the IDF. It operates Israel's National Human Milk Bank and serves as the medical mass casualty response partner for the Homefront Command, IDF, police, and fire services. With more than 35,000 volunteers and 3,500 staff, MADA provides services to the entire country 24/7. It also serves as the country's representative to the International Federation of the Red Cross, the alliance of the Red Cross societies around the world. It has no relationship to the International Committee of the Red Cross in Geneva, which is tasked with enforcing the tenets of the Geneva Convention. MADA plays a historic role on October 7th and the days that followed, deploying armored ambulances to rescue and treat hundreds of civilians, IDF soldiers, and police. Since the beginning of the war in Gaza, 14 MDA ambulances were destroyed, and more than 40 MDA volunteers and staff lost their lives. MADA is primarily funded through insurance reimbursements, fee-for-service projects, and philanthropy. American Friends of Magen David Adom is proud to be its largest supporting organization through the generosity of you, our American donors. Across the country and around the world, people are living longer. Most want to live independently in their own homes for as long as possible. And for many, that's the right choice and something to be celebrated. But independence also requires preparation. The risk of a fall, a medical emergency, or a sudden crisis aren't reasons to give up autonomy, but they are reasons to think carefully about what support looks like, what systems exist, and where those gaps are. Today's conversation is about exactly that: how to help people who live alone be genuinely safer when it matters most. We'll be looking at how to manage risk and what happens in moments of crisis. We'll explore the systems that exist in both Israel and the United States when there is no family member nearby, and examine where additional support and coordination are still needed. Our guests have seen crises up close, whether as a first responder operating under constant pressure in Israel, or as an expert studying the realities of aging and vulnerability. Today's conversation brings together lived experience and frontline insight. Saskia and Yoni, thank you very much for joining us today. Our first topic is solo aging, a term I wasn't familiar with before meeting our panelists. Saskia, as people live longer and are aging alone, the challenges don't stop with the individual, but ripple out to their families as well. What does that look like in practice, and where do the biggest pressures tend to surface?
Thanks, Kathy. Kathy, Naomi, Yoni, I want to thank you for having me here today. I'm honored to be here with you and very grateful for the generous introduction. Kathy, you framed it just right. Around 90% of adults over the age of 65 in America want to stay in their homes for as long as possible. And that is not inherently bad even if you're doing it alone, so solo aging. There's lots of evidence that shows that familiar routines and established social circles and communities are very supportive of maintaining your physical, your emotional, and your cognitive health. So I just want to start there. As you said, it's important to prepare. There are some very real risks to be aware of. And I think those risks sort of fall into three categories. The first is the tangible risks. If you're alone at home and there's an accident or an acute health emergency, you have to think about the response time for an incident. How quickly is someone going to know that you're hurt, and can they get to you? And the second big risk, and this is one we often overlook because we're so comfortable in our homes, is the risk of falls. About a quarter of older adults in America fall each year, and it's the leading cause of fatal and non-fatal injury. Our bodies just become increasingly vulnerable to falls as we age. We have decline in muscle mass, our balance and reaction time isn't as good, we might have issues with vision and proprioception, so our sense of where our body is in space, blood pressure issues, multiple medications. We just have a lot less margin for error as we grow older. And most of the falls, when they happen at home, and they're home safety issues: loose rugs, stairs, slippery bathrooms, the thresholds between rooms. Those are real risks for older adults. And the most serious consequences are hip fractures and traumatic brain injuries. I'm sure Yoni's going to be able to speak to what he sees when he shows up in older adults' homes. After a hip fracture, it's a very serious injury. A quarter of people who suffer hip fractures don't survive the year, and fewer than half of them will recover their previous level of function. So that's the first big risk that I see. The second is a more intangible one at the individual level, which is loneliness and isolation. We know from the data that chronic loneliness is very bad for your health. There was a Surgeon General report in 2023 that equated it to smoking up to 15 cigarettes a day. It elevates your risk of heart disease, of stroke, of dementia, as well as anxiety and depression. So if you are living alone, it's very important to maintain your social circles. And then finally, you asked me about how that ripples out to the family. Well, it's logistics. Your family members may not be close by or easily able to respond. But it's also a systemic issue. Elder care in this country is very expensive, very fragmented. And unless you have long-term care insurance, when circumstances change, perhaps you unfortunately have that hip fracture, the weight of care for an older adult often falls on the family, and often on one family caregiver. So about 80% of care in this country is delivered by an informal family caregiver, and that produces its own stresses and health risks for the person performing it.
Incredible information. Yoni, when something goes wrong and no one is there, you're often the one that gets a call. What have those moments revealed to you about the realities of aging alone that most people don't see? How does Magen David Adom help older adults who are on their own?
So first, thank you for having me and for all of you joining us. Israel is a relatively, not only chronically a young family, chronologically, but the overall society age group in Israel is relatively young. But at the same time, we see the growth in aging people, and the Israeli entire medical system is dealing with it. And of course, Magen David Adom also, because we are being called to people when they need us. And so in addition to a wide variety of known medical problems that people suffer from, and sometimes whether they are chronic or all of a sudden there's something goes wrong, whether in the pulse irregularity, seizures, and so forth. As Saskia mentioned, the biggest amount of issues are people who are falling. And by the way, well, I'm sure you are aware that we had kind of nearly 2 months of constant red alerts over the past kind of 2.5 months or 3 months. One of the things that we have witnessed is that, and people were hearing the siren and running to the bomb shelter, whether it's in their own apartment or they had to go down several staircases to the underground bomb shelter that they had in their building. And when it usually happened in the middle of the night, people were beginning to walk in their apartment or to run and to fall down because they have changed their overall physical position. And if the light is off and they're dizzy and they're in an anxiety, and it's something that happens again and again, sometimes 2, 3, 4 times a night or during the day, we saw people, and the vast majority of the people in Israel that were hurt at that time were hurt when they fell down, not because of any external force that was imposed on them. No rocket, nothing. And of course, we see another thing that is happening, and it is, I think, one of the modern diseases of the modern life, are all the electrical scooters, bicycles in the public domain, that the riders are using them constantly and are not paying attention to the fact that all the people reactions are much slower the younger people. And we daily see this type of collisions between these electrical vehicles and pedestrians. And when it happens to elderly people, we see sometimes dramatic results. And let's say in the city of Tel Aviv only, there are at least 40 to 50 cases of this type of accidents every day because of the couriers that are using these electrical and so on, and young people and whatever. And the most vulnerable part of the society are the elderly people. And by the way, children sometimes. So this is what we are dealing with in order to assist these people. And they're, of course, not always calm and so on. They're in pain, they're disorientated and so forth. And we are the first responders who reach to them, try to assess their condition, immobilize them, treat them, and while speaking to them and holding their hands. And this is, I think, one of the key factors that we teach every person in Magen David Adom from the age of 15. First and foremost, be human. Don't only treat the injury, treat the person. And that will calm them down until they will reach definitive care in the emergency rooms.
That's an amazing statistic. Let's switch to another critical topic, responding to emergencies. We tend to assume that we'll be ready for a crisis, but that's not always the case. Saskia, really, how prepared are most older adults for emergencies, and where does that preparedness tend to fall short?
I'm sorry to say we're actually not very well prepared for emergencies as a general matter, not just older adults, all of us, but older adults in particular. Whether we're talking about accidents or serious health events in the home or the need to evacuate for any reason. Of course, with accidents, we're often just fine right up until the moment that we're not. We just don't know when that turning point is going to be. I'm thinking of a case in particular of an older man who was living very successfully in his own home at the age of almost 90 in a walk-up apartment here in New York, who was doing just fine until he fell in the shower. And he was screaming for help for several hours because none of his neighbors were home. So you are just fine until you are not. So where do we fall short? Well, it's on prevention mostly in terms of avoiding falls at home. And there's some pretty simple things that you can do for a home safety assessment. There's lots of lists online for checklists that you can do to take a look at your home and make the needed modifications. Pay special attention to stairs, bathrooms, entrances, and your circulation routes. So the way that you move through your home, you want to avoid having loose rugs and loose cords and so forth. You can do that professionally. You can get that checklist done professionally with an occupational therapist. That's a service that exists. Or you can download one online. I'm writing about this week, actually. The other important thing to do is medication review. Many older adults are on 5 or 6 or more medications. And some of those combinations or the medications themselves can increase your fall risk. So it's important to sit down with your doctor or talk to your pharmacist about the combination of medications that you're taking with an eye to fall risk in particular. And if there is a heightened fall risk, talk to your doctor about whether there are appropriate changes that can be made. And then, functional fitness is an important one. That doesn't necessarily mean you need to get to the gym if you're not a gym goer already, but make sure that you are managing the stairs, getting in and out of chairs comfortably. Are you able to brace yourself with a grab bar? Can you get up off the floor if you fall? These are really important functional fitness goals for all older adults. These are the baseline things that you need to maintain as you get older. And the final thing I'll say is have an emergency plan. That can often include a fall alert, although I'm sure Yoni will tell us that as a paramedic, they produce a lot of false positives, but they're getting better slowly. Have a phone nearby. Many people just have a cell phone, so just make sure it's with you all the time. My mother keeps hers in her pocket now. I've nagged her enough that she does that. Have an emergency contact that can be there quickly, and have a healthcare proxy that can help with decision making if you are unable to do that yourself. And the final thing, which is critical, because in an emergency, it's hard to remember all the details of your health or your loved one's health. Have a health profile, a one-page sheet that has your diagnoses, the medications that you're taking, maybe some details about your baseline function if you're already dealing with some health issues. So, are you mobile? Are you continent? Are you cognitively aware? Those sorts of things will be really helpful. And if you have any heart issues, one paramedic told me it's really helpful to have an EKG, a copy of your most recent EKG attached to that health profile, so that when Yoni arrives to take care of you, he can take a look at that EKG and see if it's sort of in keeping with your normal heart rate or whether something more is going on.
And that health profile, are there samples of that online that people could identify?
Yeah,
and
you can find them online. I also produced a list of the useful things that you can put in it in the Aging Almanac, but there are several places that you can find basic health profiles, PDFs that you could print. I'm sure the CDC has one that's very straightforward. But the important thing is diagnoses, prescriptions, your baseline, and if there's any heart issues, and you have a copy of the EKG, that's really helpful.
Terrific. Yoni, you've responded to emergencies at every scale. When older adults are involved, what makes these situations more complicated or more urgent than people might expect? What happens to older adults during missile and terror attacks and during wartime?
Well, I think that the main issue is, in addition to the current medical problem, which is sometimes easy to assess and sometimes extremely difficult, as Saskia mentioned, that there are a variety of medical issues that the person is, let's say, carrying with him, and we need to define what is the most urgent one, what caused the current situation. And this is a triage. Now, there might be a variety of obstacles to get to that point. First, documentation, as mentioned. If there is a documentation nearby, if it happens at home, then there's a higher chance that you carry it with you. But if not, you don't carry it in your pocket or in your bag. Some people now are using smartphones, and you can use your smart watches, advancements that are connected to your smartphones, and they can carry the data and put it in a file in your phone that connects to your phone, to your wristwatch, that you can also call for help from it. You don't need to reach out to the phone if it fell next to you. You can have or conduct conversations through your watch and have the data there. Language sometimes can also be a barrier. Israel is absorbing people from all over the world, and some do not speak good Hebrew. So you need to see how you can manage with them. And since in Magen David Adom we have people from the entire different parts of the Israeli society, sometimes we can manage even by connecting via a kind of video chat to one of our colleagues sitting in the call center or in another ambulance that we know speaks Russian, in order to speak properly with the patient, or it could be Arabic, or anything else. But the communication is a huge challenge, because lack of communication can be misleading, and we can make mistakes. And the time that our teams are interacting with the patient is relatively short. And we don't have the time to assess, like in the hospital, and do a variety of imaginations and use these types of devices. It's what we check within the 10, 15 minutes, and then, if needed, take the patient into the ambulance and drive to the hospital, which is also relatively short. So we need to try and compress all the abilities of communication and get the information from them. One last thing, we have introduced years ago an application that any Israeli can download to their cellular phone. And when you download it, we ask you to fill in addition to your personal name, etc., information, also your current medical situation, and upload your own documents to this phone. And it stays in your phone. Nobody knows that you wrote it, that you appeared, unless when you click on the red button inside the app and you get in touch with us, then our call taker see the entire information that you have uploaded in time of an emergency. And then we have better sense, and this information is being sent to the responding units that are on their way to you. So when they get over, they have the information that the patient is telling us, but also they have the documents in writing that our patient had uploaded some time ago.
And I will mention to everyone on the webinar that the app is going to be available here in the States, probably within the next month to month and a half. And we will encourage anyone going to Israel to download the app. It'll be in English. It's HIPAA compliant. And it's that opportunity to have your health information there and available should you ever need it. We hope that you'll never need to call us, but if you do, then it's incredibly helpful to have that information. And we'll send out an e-blast to everyone in this webinar, but also all our donor base to let them know when the app is available. Thank you for mentioning that, Yoni. I think it's really an important consideration. You know, Saskia mentioned that support to caregivers and typically family members who are caregivers is so important. And it's become increasingly really a public conversation about how do we need to support caregivers. Caregiving is often invisible work until something goes wrong. Although we don't always talk about this as a society, we're recognizing more clearly than ever that caregivers need support too. Saskia, where do caregivers most often feel unprepared, even if they don't realize it at first? What are some of the ways caregivers can stay nurtured and feel supported as they do the crucial work of helping an older loved one?
Such a good question, so important. I think they feel unprepared with, first and foremost, the breadth of tasks that they're taking on. And it can be quite a slow creep as your loved one needs more help. Particularly in this country, managing appointments, insurance, finances, even medical tasks that would normally have been done in a clinic or hospital setting are now falling to family caregivers. They're managing catheters and so forth. Then I think, the pressure that it places on other parts of your life, work, marriage, children. Caregiving never happens in a vacuum, right? You have lots of other things happening. And also the pressure on your broader family relationships, particularly if the weight of caregiving is falling on one person. So sibling relationships are often quite frayed by a caregiving situation. So some of the ways that caregivers can take care of themselves and we can take care of the caregivers in our lives, I'd say three things. They need to recognize their role. We often don't call ourselves caregivers if we're doing it. I'm just a daughter doing my love and duty for my parents. But by recognizing that I am taking on this role, this job, it's validating, first of all. But the health system requires that they record who the caregiver is. At least in this country, it is a requirement to record the caregiver. And that opens the door to all sorts of communication channels and support for the caregiver. So financial support, there's increasingly therapeutic support for caregivers, and then support with logistics through social workers and geriatric care managers and things of that nature. The second thing I would say is get that help, take advantage of it, whether it's professional therapy or paid help through a home health agency or Medicaid, if that's what you need. Get support from your employer. Make a family plan to divide the tasks to try and manage that sibling dynamic, and be really creative about asking for informal help. There will, of course, be people that disappoint you, but if you are overwhelmed, ask people in your life for specific things, like, I need a night off on Thursday, can you come over? And don't be shy about who you ask. You will be really surprised by who says yes. And the final thing I will say is take care of yourself, self-care. And I'm not talking about a spa day, which is often what people think about when you say self-care. I'm not talking about a spa day. I'm meaning don't neglect your own health. I have a very good psychotherapist that I interviewed recently who describes caregivers as patients in waiting. They often neglect their own medical appointments, their own health, and they're under chronic stress, and they become unwell themselves. So set boundaries around your time, be selective about who and what you give your energy to, and make sure that you take care of your own health.
I suspect one of the greatest challenges is that communication, that willingness to ask for help and to feel like it's legitimate to ask for that help. right? I think often people are very hesitant, certainly Americans, to ask for help, and they think that strength that they're showing is supposed to be appreciated and valued, but asking for help is probably one of the most important things a caregiver can do.
And people want to help.
Excellent. Yoni, when your teams arrive, you're stepping into a very personal moment. What considerations go into navigating that situation to ensure that it goes smoothly? And what do you do if it doesn't? You've got the patient, you have potentially family members, and it could be a very strained dynamic. Tell us what your experiences are.
So during the training phase of our team members, we speak a lot about cultural differences and get them to understand that they come from a certain background, but the chances that they will treat people from other backgrounds, whether Orthodox Jews, whether new immigrants for certain countries, whether from the Israeli Arab society, and so on. And each part or each society in Israel have their own different codes of behavior. And sometimes asking a question, which is a very common, legitimate question to a lady because she has severe stomach aches, when the mother of her husband is in the room, can cause a huge family issue, because there are a lot of delicate things that we need to consider while speaking and checking and treating a patient. There are certain societies in Israel that people feel, women, for example, will feel uncomfortable if a male caregiver, EMT or a paramedic, will touch them and check their pulse, blood pressure, and treat them. So we need to see if we can merge team or combine teams of men and women and so on. And this is why we work a lot to make sure that we have volunteers and employees throughout the country for any known background, social background, religion background, and faith backgrounds. So it will be easier for us. And from that fact, it's also easier to educate the other team members and build up some kind of a common knowledge within the organization. It is not always easy to deal with elderly people. I remember that when I was the manager of the Jerusalem region years ago, and one of our team members that was with us for many years comes in tears to my office and I said, what happened? And said, I need some therapy. So what happened? I was treating an elderly lady with not such a severe medical issue, but she reminded me of my own grandmother that passed away not long ago. And that created or created a stress reaction. So we have to be also, as Saskia mentioned, we need to give the knowledge and the understanding to our peers that they're human beings and their feelings are normal. And we need to assist them and help them. And at the same time, if they know that they can be assisted, their reactions toward the patient is much better, because they feel that there's let's say, they have a stronger backbone of support behind them. And this is part of the issues. And I'm putting aside all the dramatic medical cases that we are dealing with, because there's a wide variety. You can open any TV channel and you can see ER and this and that and 911 and whatever. You will eventually see the entire spectrum and even more dramatic. But again, the most crucial thing is the human aspect of personal reaction to people, even if it is a stressful situation, whether medically or in general.
Yoni, could you share with us, often I suspect some of the more difficult cases are perhaps dealing with people with dementia. And I'm wondering if EMTs and paramedics get any kind of special training in terms of how they deal with dementia patients.
I think that you can't really prepare people to treat people with dementia. You have to witness it and you have to experience it, and hopefully you might be able to experience it with somebody who already have a little bit of experience, because not always you can understand the reaction of the patient. Not always you can be fully aware whether what they're saying is 100% false or partly false. And if there are family members or caregivers that know them, that are nearby, you can better rely on them. But then again, sometimes, again, it's not always the full picture.
Thank you. Let's turn to the role of social services, especially with those solo agers. Forgive me. There are many services that are available to support people as they age, but too often people either don't know what's available or don't know how to navigate it, don't recognize that they need it until they're already in crisis. Saskia, why is it so difficult for people to build a coordinated plan as they age? Where do the systems break down? And is there something we should be doing to create that plan for our loved ones?
Such a good question. I think, the place to start is that we have really negative societal attitudes towards aging. And I really think that needs to change, because with good planning, we can age with dignity and intention. People can have very, very rich lives. But it's hard to plan for something that you dread. And it's hard to recognize and accept that things might be changing, both emotionally and in practical terms. Making your way around your own house. It's not as though you wake up one day and it's hard to get in and out of the bathtub. It sort of creeps up on you slowly, and it's hard to recognize when the time has come to put in some grab bars or remodel for a walk-in shower. So that's the starting point, I think, why we avoid planning. The second thing I think is that support services, insurance coverage, medical care is extremely fragmented in the United States. State by state, locality by locality can be very, very different. And it's really hard to navigate. The information isn't sort of neatly consolidated in any one place. And if you're starting in a crisis, that can be really, really challenging. So the third thing I'd say is, to plan ahead and start before you need the help. It can be a lot less scary if you're starting ahead and say, okay, I'm healthy today. I'm going to plan for a future in which I'm less healthy, less mobile, and think about the sorts of things that I might need. And then you have a just in case list. So, I would start with important conversations with your family members. I like to say that as soon as you're in the 40-70 zone, and by that I mean adult children in their 40s and parents in their 70s, if you are in that zone, you should be having these conversations if you haven't already. The 3 conversations you have about your finances, because almost every other decision flows from what you can afford. So your finances, what you want for your housing, where do you want to live? What do you want your home environment to look and feel like? You might want to stay in this home, or move to a new home. And then what do you want for your healthcare? And that can be, your healthcare in extremis. Would you want extreme measures in a very serious situation? But it can also be sort of broadly about your values around healthcare. Would you do anything for another day on this earth? Or would you be a little more circumspect, like, What does a good and quality life look to you? And those are conversations you can have today. I've had these conversations with my own children, and I'm in my 40s. And I would encourage everybody to be having these conversations with your family members, even when it makes your family members uncomfortable. You don't have to do it all at once. Then do the prevention work that we talked about, the home safety, the medication review, the functional fitness, the social engagement, making sure that you're out and you're active, and the emergency plan. That is part of your broader planning. And research the services that you might need. You may not need Meals on Wheels now, but researching where you might be able to get a meal service if you need it. That's a useful phone number or an email or a website address to have on your list. Most big cities have an area agency on aging that will list all the variety of services that older adults qualify for in the city. That's a decent place to start, although the listings aren't always accurate and up to date, as you can imagine. But they will have listings for meal services, home health agencies, transportation services, social activities, daycare centers. And you can also ask your friends. What services are they receiving? What have they liked? What has worked for them? What hasn't worked for them? I think we should all be comfortable having these conversations with each other. We're all growing older one day at a time. So let's do it thoughtfully.
Sage advice. Yoni, from your vantage point, what happens in Israel when those systems, as Saskia just mentioned, aren't aligned? What gaps do you see and experience firsthand? How does Magen David Adom work with social service providers and volunteers to help older adults?
So once again, it depends on each and every city, each and every community, and so on, and how they, let's say, build up their capacities in social services, helping the aging. Do they have activities for them during the day? Shows, cultural things, etc. Is it easy for the people to get connected with these type of organized groups and so on? Some communities are building out what it's called a safe home program, that they have some kind of a private company that want to tender, and they use beepers that they install in your home, and you can wear it on your wrist or anywhere else, and it is a transmitter in your own home connected to the old phone line and now to the new cell phone. And in case you are not well and you cannot reach the phone, etc., all you need is to push the button. But you have to make sure that the button is on you. For my late mother, she didn't like it, so I used to connect it to the walking cane and the walking aid, so it will be nearby her. So this is one system. These organizations, or they have call centers, they have the database of the people in case something happens, and it can be anything. They can ask for medical assistance, they can ask for food on wheels, they can ask for if there is a technical issue in their home, and they deal with connecting the professionals with them. And when it comes to medical emergencies, they can connect us and we can respond to them. That's in addition to our own application. And part of the things that we do with our youth volunteers, we train them to work and assist their own elderly people in their street, in their neighborhood, in their apartment building, as part of their initial education, to map the needs. As Saskia said, make a safe environment in your home. What are the risks in your home that you need to take care of? They might be extremely simple to deal with. Some of them also do it at home, or call their parents and other neighbors or members of the community and help in to make sure that their neighbors will live more safely and they will know in case that they are not well, that their neighbors care about them and they can use them and utilize them and get some assistance from them, especially if they live alone and they have no any additional assistance and their children are far away, and sometimes they don't even want to trouble them because they have young children and whatever. So this is part of what we are trying to achieve. It is connected to the strength of each municipality, community, etc. But it is growing all the time in Israel, and our awareness to that is growing. And still, I think that we have a long way to go, to be even better than to what we are currently are.
I suspect one of the great challenges is people finding their entry point into the social services system and being able to identify what services are actually there for them and how to access them. Saskia, do you have any advice about that?
Well, I think you can look at the local area agency on aging, and that is a good place to start. And you can call them. They have navigators that will ask you about the needs that you have, and then try to connect you with the services that you need. I will say that the quality of that service is a little spotty at times, but it is a good place to start. If you have the budget for it, there are geriatric care managers. Now, their expertise is in coming into the home, assessing your level of function and mobility and the needs that you may have, and creating a comprehensive care plan for you. You can hire them by the hour or hire them full time to keep an eye on your care, but they can create a care plan for you and then connect you to the services that you need. So if you need PT or OT at home, they can set up that connection. If you need home health aides in the home, they can set that up. Even if you're dealing with a dementia diagnosis in the family, they can then support you to go through the process of applying for Medicaid, which is what these families often need to do because dementia care becomes so expensive. So a geriatric care manager is a wonderful resource for the families that have the budget even to hire for an hour, because they'll give you a really good starting point for accessing the services that you need.
Very helpful information. Thank you. We talk a lot about technology, and technology plays a role in so many aspects of our lives. Let's discuss how technology can impact our solo agers. Saskia, as today's older adults are living longer and even more tech savvy than any generation before them, what role do you see technology playing in helping people stay independent, connected, and safe as they age? And where do you think the potential is still not fully realized?
So I think it has huge potential for supporting safety and independence. We're already seeing that in the evolution of these personal fall alerts. They're becoming much more reliable. Some of them have GPS sensors for dementia patients that may wander. They're really becoming quite sophisticated. There are now internet-connected medication dispensers. I know of an elderly lady in Queens whose daughter in Washington is managing her medication schedule through this machine. You can get, of course, if you live in a big city, you can get online delivery of almost anything now. And there are, really good applications for care circles. So if you are sharing the care of a loved one with your siblings, neighbors, friends, you can coordinate tasks, visits, finances, medications, communication with doctors, and so on. Also think, I'd be remiss if I didn't mention AI. Everybody's talking about AI now. Can be an incredibly useful way to prepare questions for doctor's appointments, especially if you know your time will be short, to find local resources, to research and understand how to access support. I would caution, beware not to use it for medical advice. They say don't ask Dr. Google. Well, don't ask Dr. ChatGPT or Dr. Claude either. It's getting better, but AI still has hallucinations and will tell you things that are completely incorrect. So really be cautious about doing that. I have seen, they're just beginning to come out, but they're getting more sophisticated also. AI chatbots that can coach you to have healthy behaviors. It sort of becomes a bit of a game. Like, how far did you walk today? How was your sleep? What are you eating? And there are insurance companies that are starting to roll this out for their beneficiaries, to encourage their beneficiaries to be healthier.
Okay.
We're also seeing AI chatbots being used to alleviate loneliness. Some long-term care facilities are experimenting with sort of AI friends for their residents that they might speak to on the phone. It's an idea that can produce some really strong emotional reactions, including in myself. Like, I'm not sure that I would want my mother being friends with an AI chatbot, because we do value human connection so much. But some residents apparently really enjoy it, especially since the chatbot is always happy to hear your really long and boring stories about your baseball passion or whatever is on your mind at that time. But so far, there's no large-scale studies on how effective it is in alleviating loneliness or depression. So the jury's very much out, but these are some of the experiments that are happening. Where the potential's not fully realized, we touched on this earlier with Yoni, is the fragmentation of health information and how important it is to have one consolidated place where all your information is, especially in an emergency, but even as a general matter. I know of many older adults whose dining table will be full of old medication bottles that they can't make sense of. It's really important to have a single view on all your healthcare, even if you have a lot of doctors and a lot of medications and a lot of different things you're managing. Try to figure out who can be the quarterback of that care. It might be your family doctor, your PCP, or you might have a good relationship with your neurologist or your cardiologist. Ask them to be the quarterback for your care, so that there's one person that has a view on everything. And I don't think that, I don't think technology is helping us with that yet, but we really need it to, especially in the States. I mean, we all have, even if you're healthy, you probably have six different doctors, specialists looking at different parts of your body. And they don't talk to each other. Communication's really poor. So, and I think that's something that there's tremendous potential to try and solve that.
Thank you. Yoni, in emergency response, we always say every second counts. How is technology changing the way that Magen David Adom reaches and supports older adults in real time? And what new possibilities are opening up with regard to technology in your work?
So we invest a lot in our emergency technology, call centers, applications, and so on. And we have reached a point that our command and control system is extremely sophisticated. It starts with a quick access to the system. When in Israel, we fortunately do not have the 911 system, which is pretty much kind of a buffer. If you need emergency medical assistance in Israel, you dial 101 or click on the button on the Magen David Adom app, and a professional on the other side of the line will pick up the phone. And highly trained EMT or a paramedic will begin to listen to you, ask you questions, understand, and do the over-the-phone triage at the same time, according to what this call receiver will determine as urgent. While speaking with you, the system will automatically trace your location and the nearby Magen David Adom EMTs and paramedics on ambulances or rapid response vehicles or motorbikes that are closer to you, and they will get a call automatically through the system to their cell phone and to the tablets on the vehicles, and will start heading towards you while you're still speaking with the person online. If you are using the app, our app, we will pass on the data as mentioned, what you have already uploaded about your medical condition, medical documentation, medications, etc., to the responding teams. After they will reach you and check you and treat you, we send the information, if needed, to the receiving hospital. And the Israeli system, since we are kind of a small, agitated country, we can bring a patient with a current heart attack, bypass the emergency room, straight to the catheterization, and all we need is to just alert the team at the catheterization team. The same with stroke, the same with trauma patients to trauma centers, even women who are just about to have a baby delivered. We pre-alert the delivery room in the hospital using the data or the technologies that we have among us. And we want to develop it further on. And we're also using monitors, defibrillators, etc., that team up with this overall technology. For example, we have placed thousands of AEDs, automatic defibrillators, in the public domain, in secured, closed boxes in the street in Israel. If somebody calls us because he saw somebody fainting in the street, we will guide them what to do, ask them to send a person nearby that stand nearby them to the near public AED, and we will open the door of the public AED of this box from our call center. And they will bring the AED to them, and the AED will speak to you and tell you what to do. But not only that, the AED has a SIM card. So once you attach the AED to the patient, our call takers will see the lifeline, and the medical supervision center will see the heart rate, if it exists or not. And even if the person is guided to do cardiac compressions, we will know the quality of the cardiac compression and guide them better how to do it more properly. I think that technology is endless, and AI can, I don't know, do other wonders, but again and again, we all the time remember to go back to the human factor, because eventually we are human beings that are called to treat other human beings, and it's not a diagram, it's a person. And I think eventually this is the biggest challenge. And I always laugh at colleagues of mine who are doctors, who are specialists, and I say, you are a specialist only for the right hand. But what about the left one? And this is where we need to make sure that we are not missing, because missing might be hectic for our patients.
Of course, of course. I think we could have continued this conversation for hours. It is so important. And you have both been just so helpful. And so you're educating us and sharing things, hopefully help lower our stress levels a little bit. And at the same time, give us knowledge to think about it, whether it's ourselves or our family members. I want to thank both Saskia and Yoni for this engaging conversation. And thank you to everyone who joined us today. I want to make sure you know that you can follow Saskia's work at the Aging Almanac at agingalmanac.substack.com. And if you found this conversation meaningful, we invite you to learn more about joining our AFMDA Legacy Circle and helping ensure that when the call comes, someone is always ready to answer it. Please visit our website at www.afmda.org or contact your local AFMDA office. And thank you so much again for joining us today. It's been a wonderful conversation. Bye-bye.